Namaskar and a very warm welcome to the 19th edition of the phone-in program. I'm Nidhi Kumar and you're watching India Science. Well, India has vaccinated 20 crore people till now. And in this phone-in program, you can ask your questions, we'll take your queries live. So today we have an expert with us, Dr. Kapil Sikka, MS, DNB, Additional Professor ENT, All India Institute of Medical Sciences, New Delhi. Many thanks for joining us, Dr. Sikka. Thank you so much and welcome to India Science.
Thank you, ma'am. Yeah.
So, doctor, my first question to you would be naturally about black fungus and the occurrence of black fungus, which is now being witnessed in several coronavirus COVID-19 SARS-2 cases. How is this different from the symptoms that we saw in the first wave, sir?
So, ma'am, black fungus is actually a misnomer, if I may call it, because this is not exactly black fungus that is black. But the manifestations that it causes in the patient is that it invades the blood vessels. It enters into the blood vessels inside and around the nose, and it leads to blackening of area of skin in and around the nose as well as inside the mouth. So that gives a very characteristic appearance to the patient, which appears black because of gangrene or necrosis. So that's why it has assumed the terminology as black fungus. This is not a new disease. We have been seeing black fungus or mucormycosis, which we should more aptly call it. It has been known for ages, but yes, there has been a sudden increase in number of cases through this pandemic, and there are various factors which are possibly attributing to it. One important factor which I must highlight here is use of steroids supplemented with uncontrolled diabetes in most patients.
Absolutely. Doctor, are you trying to say that it happens in COVID recovery cases, in also cases that are seen to have more steroids, like you said, but also is it due to the administration of oxygen which may have been done in the hospital? Is something going wrong there as well? Would you like to highlight that?
Yes, ma'am. So we are seeing a lot of mucormycosis or black fungus cases these days. We are maintaining a very good database on how many patients have received oxygen, how many patients have received steroids, how many patients were diabetic. So if I may put our own data, it is suggestive that most of these patients, I would say more than 95%, are diabetes. They were non-diabetic before they got COVID. The diabetes got worsened because of steroids. I must mention here also that the COVID is itself diabetogenic, and it is itself is immune suppressant virus. The patient who even doesn't have diabetes, they also have a tendency for immune suppression because of COVID, and COVID is also a diabetogenic. So patients who did not have diabetes pre-COVID, they do develop diabetes after they get coronavirus infection, and that worsens this problem. Regarding oxygen, that's a very good question. It's a very hot topic that is being discussed. But frankly, if you ask me, our data is not suggesting that many patients, they were or are under treatment for oxygen. There are a group of patients, because anyway, steroids are administered to the patients who have got moderate or severe disease. So it might be a association. But till date, we do not have data to suggest that oxygen contributes to black fungus or mucormycosis. But it's more of steroids and immune suppression.
Absolutely, and we'll take those questions on black fungus as well. Meanwhile, we're joined by our first caller. I would like to welcome Harish Ji from Ghaziabad. Namaste, Harish Ji. Welcome to India Science. Harish Sharma, please ask your question.
Namaste. Can COVID-19 be detected by CT scan? Kindly tell us how.
So the question that I heard is that can COVID be diagnosed with a CT scan, if I am not mistaken?
Yes, sir.
So COVID-19 CT scan is not used generally for diagnosis of COVID-19 infection. The diagnosis is established by clinical signs and symptoms, and the gold standard test is detection of viral genetic material with PCR or with rapid antigen or with CBNet or TrueNet testing. Yes, CT scan is helpful, but it is helpful in scenarios where you have to ascertain the spread of infection lower down into the respiratory tract, into lungs, and it manifests as pneumonia. Second role of CT scan is in prognosticating how much is the spread, how bad are the lungs, and how bad is the post-COVID fibrosis. So in those scenarios, CT scan is useful, but yes, it gives you a clue towards diagnosis in which clinical suspicion is high, but RT-PCR is coming negative. In other scenarios, just for diagnosing that I have a sore throat or I have a upper respiratory infection, I have cold, and I rush to get a CT scan, it will diagnose COVID in me. That is a wrong philosophy.
I hope that answers your question, Hariji. Thank you for joining us. Doctor, I'd like to now ask you, as people are kind of speculating about the third wave, we saw that the COVID first wave had taken away a lot of people in the elderly population. Similarly, in the second wave, we saw that the groups which are more susceptible have been from the age group of, say, 35 to 48, 50, this age group has been really widely affected. So, in the third wave, people are speculating, doctors and scientists have all aired their views that they have an apprehension that the virus might mutate and we might have a lot of young children, in fact, who would be affected by this virus. What are your views, sir, if you could take us through that?
So, ma'am, simply speaking, virus is nothing but a genetic material and it is enveloped by a protein envelope. It needs a lot of mutations to survive. If its environment becomes hostile, if it's not able to survive in its environment, it will change its genetic material, and that is called as mutation. We have heard about single mutation, single mutant, double mutant, and all these things. So it will change its genetic material and it will help it survive in those hostile environments. Yes, you are right. The wave has somehow hit relatively the younger population, and there are speculations that it will hit the children or even younger population in second wave. But by and large, our experience has suggested that children have been impacted in first and second wave also. So the speculations are merely on basis of past experiences and somewhat recently emerging scientific evidence. But yes, we have to be careful. Third wave has been seen in previous pandemics. It has been our experience. And the usual norms of protecting ourselves with COVID appropriate behavior should be undertaken.
Meanwhile, we are joined by another caller, Dr. Rani from Nagpur. Namaste Rani ji, welcome to India Science. Please ask your question.
Sir, my question is, there have been reports linking AstraZeneca and blood clots. So could you tell us a bit more about that?
AstraZeneca?
And blood
vaccine.
clots.
Yeah. So the question that I am getting is the vaccine in relation to black fungus?
No, sir.
Blood clots, which lead to, yes.
So,
yes.
If you ask my opinion, each and every intervention in medical science is seen with the risk-benefit ratio. So, if you talk about risks associated with COVID infection, they have all been in front of us. We have seen high morbidity. We have seen oxygen requirement in patients. We have seen increased hospitalization, and we have seen increased mortality. So COVID is a dangerous disease. If you talk about blood clots, yes, there has been some evidence published from some regions in the world that it does lead to somewhat increased evidence. But as an expert, if you ask me my opinion, I would say that everyone should take a vaccine. Ignoring the minor possible side effects or adverse events that can happen because of vaccine.
Absolutely. I hope that answers your question, Rani. Another question that I would like to perhaps pose to you is also there on our YouTube right now. And the viewers want to know, sir, what would you term as airborne transmission and how transmissible is it? What is the vis-a-vis closed doors? There are several theories like ventilation coming out now. So how would you like to term this?
So there is no doubt there has been evidence that the transmissibility of these mutant strains, they are much more than they were seen in the first mutant viruses, the initial first wave viruses. There is evidence that there is an airborne transmission. But if you read between the lines, if you read the literature or the Lancet articles between the lines, they have more specifically mentioned about closed door transmission. So if I may put it that way, that there are 100 people in the room and there are 5 people in a room, and out of 100, if 3 or 4 of them are COVID infected, then you may certainly call it as a community transmission or an airborne transmission. Yes, that is true. But again, so many people in a closed room, you will not call it as COVID appropriate behavior. So I would suggest, yes, this virus is more transmissible. Previous virus, which we saw in first wave, it was more of droplet infection. That is, while you speak or cough, there used to be droplet which used to fall down and there was less chance of its transmission. But if you call that, if you call it airborne infection, yes. But if you ask me, COVID appropriate behavior is not preventing against it, that is wrong. COVID appropriate behavior, especially in high risk areas like in closed environments, in surrounded by more people, unmasked are definitely at more risk than masked, and social distancing is definitely less risky as compared to closed group of persons. So yes, there is airborne transmission. There is no doubt about it. This variant is more transmissible, but COVID appropriate behavior is definitely preventive in this wave and will be preventive in third wave also.
Absolutely. So we're joined by another caller, Akshay from Kolkata. Yes, Akshay, please ask your question.
My question is that we've seen most of the transmission of black fungus in Gujarat and Maharashtra recently. What could be the reason of this? Is it because of difference in demographics and ethnicity, or what could be the exact reason for massive spread in only 2 states?
It is not there in only 2 states. It is being reported from other areas also. There is rapid surge to the extent that we are seeing more and more patients, to the extent of creation of specialist wards in some hospitals in Delhi. There are reports from Rajasthan, Haryana, Punjab. So more or less it is from all parts of India. It is not only limited to Maharashtra and Gujarat. But yes, maybe they have been reporting more cases. There might be some theories behind this. One is that they are ahead of Delhi in terms of the wave, if I may say so. They had more cases before Delhi got that wave peak, and we might see the surge later on. Second reason, as I have already mentioned, is threefold. One is diabetes, 2 is treatment. Most of the patients who have got black fungus or mucormycosis, they were self-treated or they were treated with high dose of steroids with inadequate management of diabetes. I am not saying that steroids are not useful in treatment. They are definitely indicated as per guidelines in moderate to severe cases. But you have to limit the dosage and use it judiciously in patients only where it is indicated. So never self-medicate yourself with the steroids. So what we are seeing the surge from some areas is possibly people have self-medicated, they have used steroids without medical supervision, or they are sort of ahead of us in terms of surge, and other areas are seeing mucor after the surge appeared than in Maharashtra and Gujarat.
Thank you so much, and I hope, Akshay, that answers your question. We joined by another caller, sir, Dr. Kapil. It is Ravina from Gwalior. Yes, Ravina, welcome to India Science. Please ask your question.
Namaste, sir. Namaste, ma'am.
Yes, please.
Steroids off the shelf. There has been a little lag, I think. The call is dropped. Meanwhile, I'll ask you, Doctor, there's another question flashing on our YouTube. Could you please extrapolate on the remdesivir injection? How do you think this is helpful? How helpful is it that it is being actually black marketed and stuff like that?
Now, remdesivir is an antiviral medication. Antiviral medications actually are beneficial in viral infections. It has been very extensively studied both in and off Indian scenarios by many scientific communities. Remdesivir injection is again, as the case was for steroids, it should be used in patients who are recommended as inpatients or in hospital patients who are requiring oxygen and who are having moderate to severe disease and at least evidence of COVID pneumonia. It does not prolong survival. If out of 100 there are few patients who are to die of COVID, it does not prolong survival or make them better. But yes, it definitely decreases time for hospitalization. But again, use has to be judicious, under medical supervision, and only for patients who are in hospital, admitted under medical care.
Absolutely. And we're joined by Ravina once again. Ravina, please ask your question. She joins us from Gwalior. Yes, Ravina, go ahead.
As I was asking, like, since I wanted to know, like, is nerve deafness or disorder related to COVID-19? Is there somehow any connection?
I'm sorry, your audio is not very clear.
Hello, I'm asking
Yeah.
whether nerve deafness or disorder is somehow related to COVID-19. Could there be any relation between it?
Ma'am, if you would repeat the question in case.
Does COVID-19 have anything to do with a nervous disorder or disorder of the ear and nose is what she's trying to say.
So, ma'am, if you ask me, I am an ENT specialist and otolaryngologist. We do deal with a lot of patients who are ear, nose and throat disorders. One of the most common manifestations of COVID, which you might all have heard, is loss of taste and smell. That is one nervous disorder that COVID is leading to. So almost 60-70% of patients, they have tendency, once they recover from COVID or once they have active COVID, they lose sense of smell. But fortunately, even without treatment, it is returning back in most patients, even without any major treatments. Other nervous disorders which you were expecting me to answer was probably facial nerve weakness, hearing loss, and some ear related problems. There are some patients who have got some psychological impact, some minor degree of hearing loss and some ringing in the ear because of COVID. But if you ask me whether it is attributable to COVID, COVID has caused that, I don't think there is any added evidence for that. So only neurological problem related to ENT, which has appeared post-COVID, is lack of or loss of sense of smell and loss of taste sensation.
We joined by another caller. Meanwhile, we joined by Shivam Mathur from Surat. Namaste, Shivam.
Namaste, ma'am. Namaste, sir. So my question is, are dizziness and vertigo COVID-19 symptoms, and why?
So COVID-19 has, so his question, if I may repeat, is, are dizziness and vertigo related to COVID-19? So we have done our analysis of quite a few patients that we have treated. COVID is a multi-system disease, and dizziness and vertigo are very vague disorders. They are very common disorders. So if you ask me what is vertigo, I would say any sense of imbalance or anything where I feel that I have a tendency to fall, I am feeling giddy, I am feeling surroundings are moving around me, that common public attributes to vertigo. There is no evidence that it directly affects the hearing or balancing nerve, but yes, I personally in my practice have seen quite a few patients who have come to us with complaints or symptoms related to vertigo, imbalance or dizziness. Most of them I felt were not related to ear, but they were generally related to stress, anxiety as a sequence or sequelae of COVID. And most of them, my patients, in fact, all of them, I would say, they have responded to counseling, some vestibular rehabilitation exercises, and some degree of LA of anxiety.
Absolutely, doctor. And we're joined by yet another caller. It is Vishnu Sharma from Delhi. Namaste, Vishnu. Welcome to India Science. Please ask your question.
Namaste, madam. Can our ear canals be possible entry zone for virus?
So virus has been isolated and cultured from inside of ears during ear surgery. So I would not say that it enters from your ear, from outside the ear and enters your inside the ear, because there is a very sturdy skin-lined eardrum lining it. So I would not say that ear is a route of entry, but yes, virus can be found in your ear, but it has more to do with spread from behind the nose, the posterior part of nose or back part of nose. We call it as nasopharynx, and nasopharynx is connected to ear with the eustachian tube, a tube that we call as eustachian tube. So most likely the virus that was isolated from in the ear had traveled from nasopharynx through eustachian tube into the inner part of the ear. I will not say that virus can travel from your ear canal and it can infect you.
I hope that answers your question, and now we move on to another caller, Ria from Nagpur. Namaste Ria, please ask your question.
Hello.
Yes.
Yes, sir, my question is, a friend of mine, he is undergoing rabies injections, and he is wondering whether, in between this, can he go for COVID vaccine? If not, then
rabies infections you have mentioned.
Yes, he got bitten by a dog and he is taking rabies injections. So he's wondering whether he can.
That's a very good and relevant question in current scenario, in current settings. So in general, the experience with the COVID vaccine has not been much in terms of the cross reaction with other vaccines and antiviral treatments. But general consensus here is that if you are taking treatment or if you are taking vaccine for some disease and that has been recently administered, it is prudent or it is better to wait for maybe 6 weeks before administering COVID vaccine, because they can cross react. So I would suggest if he has taken rabies vaccine recently, he can complete that course, follow all COVID appropriate behavior, protect himself or herself without vaccine, and wait for 6 weeks and consult your physician before taking COVID vaccine.
I hope that answers your question, Ria. We have another question, doctor, on the YouTube, and it is that people are taking steroids off the shelf. Are medicines like ivermectin and omnacartil advisable to just go by WhatsApp advisory groups and have it? How dangerous can they be in the long run?
They are very dangerous. Ivermectin, I will not comment much. Ivermectin has not been sort of suggested to cause any significant immune suppression. I would say that even we have recommended it off shelf. But if you are talking about omnacartil, they are steroids. So if I explain to you briefly about immunity, there are some immune cells and there are antibodies which protect us from diseases. They should be intact. They should be appropriately intact to protect us from diseases. Mucor is everywhere. It might be in your nose, it might be in my nose also. And there are some fungus which are normally present in us, but they don't cause infection. So moment our immunity goes down, and COVID itself brings our immunity down, diabetes brings our immunity down. If you supplement these two with steroids and they are not monitored well, if I start taking steroids without prescription, even if I have a mild disease and I start taking steroids, plus COVID has caused diabetes in me, plus there is a immune suppression because of COVID, then it increases the chance of mucor-like infections in my body many fold. So a strict no to self-prescription of omnacartil or steroid-like drugs. But yes, ivermectin has not still been implicated in causing mucor-like illnesses.
So that answers your question, all of you asking. And now we're joined by another caller, Jatin from Ahmedabad. Please ask your question, Jatin.
Hello, ma'am. Hello, sir. So my question is, what strategy should India adopt to overcome the vaccine shortage?
I think it will, the task force, the advisory group and government of India are working towards vaccine shortage, overcoming this issue, and as has been the statement by many of the experts, it will soon be overcome by end of this month or next month. That is my opinion. But yes, strategy they are already adopting. They are adopting all measures to increase production. They have sort of exponentially increased the centers. They have exponentially increased the awareness amongst population. This program is one of them for creating that. Yes, if everyone is aware of benefits of vaccine, everyone is aware of dangers of COVID, and vaccine production is enhanced as it's being done, I think the vaccine shortage issue will be soon over.
Absolutely, and as we speak, I think Sputnik is in India. We're going to get Johnson and Johnson, Zydus Cadila, so
Certainly.
many other vaccines are coming. There is a little
Certainly.
confusion on the aspect of having COVID and then taking the vaccine. How much should the gap be? Supposing X person has contracted COVID, then what is the time period after which he should go in for the vaccine and why? If you could
So,
please
ma'am,
explain.
vaccine is nothing but coronavirus or part of it injected in your body to induce your antibody response. So, if this is a very simple, straightforward mechanism of action of vaccine that are being administered in our country. If the Pfizer and Moderna vaccines, they have a slightly different mechanism of action, but vaccine is nothing but killed virus injected in you so that it induces antibody response. So if you already got the virus, live virus, you got that infection and you already have that antibody response. So administering that vaccine immediately after you got COVID is a bit unnecessary if you look at the science behind the subject. So recent advisory, I think it has suggested 5 to 6 months. Till now, we were suggesting around 6 to 8 weeks after your COVID infection. But yes, we must follow the government advisory as it suggests.
Another thing of concern is, sir, that the gap between both the doses of Covishield has been increased very recently. It was earlier 4 weeks, now it has gone on to 6 to 8 weeks. What would be your comments on the same?
So, ma'am, they are being very closely monitored by the expert groups. There is definitely evidence that has emerged from the UK studies that the gap of 12 weeks is definitely beneficial than 1 month. Yes, I must admit that there is some social and vaccine availability issue also associated with increasing the gap. But yes, it gives you time to adequately develop antibodies after first dose. That will give you a protection, maybe 60-70% for 3 months. And after that, if you take second dose, then that will give you protection for another 6, 8, 12 months, and your protection will be enhanced if the gap is more. That is the essence of science behind this increasing of gap.
Absolutely.
But yes, the guidelines and this thing might change as more evidence emerges and more people are vaccinated.
Absolutely. So, we're joined by another caller. I'd like to welcome Gauri from Kanpur. Gauri, namaste. Welcome to India Science. Please ask your question, Gauri.
Hello, ma'am. Hello, sir. Sir, my question is, we are hearing a lot about double mutant. So, what exactly is that, and is the vaccine going to be effective on that virus?
So,
A question
as
on
I already
7
mentioned,
mutants, sir. May I just stop you? We're also getting a question that there are some 7 mutants present in the Vizag variant. It's flashing on my YouTube. So, if you could address both these questions, the one that she's asking also.
So, ma'am, mutation in viruses is nothing new. It is very much expected. It is definitely a thing that is going to happen. It happens with all viruses. We all get common colds. We don't get immunity to common cold. The virus mutates itself, and it will again cause that particular disease. Virus has to survive in the hostile environment, if I may say. It will mutate its genome. It will mutate its genes, and it will produce some different proteins so that it is able to survive in population. So mutations will keep on happening. There is nothing new about that. The double mutant that we are talking about is the current pandemic causing virus or Indian variant, if I may put it that way. Both Vizag as well as the double mutant that we are mentioning. The virus, by mutating itself, has emerged as a more infection causing virus. So it has mutated its genome to facilitate itself to cause infection in more individuals. Previously, the virus, if it was in one person, it had a tendency to infect 1 or 2 more or 3 more. Now this has got more infectious. If you ask me what is infectious, if I have virus, I am sitting in a closed space with 10 persons. it has a tendency that it might infect 7-8 of them. So that is the difference in increasing virulence and increasing infectivity, the double mutant virus. But if you ask me, is it more lethal? That evidence has not yet come. There has been huge data that has been put up from various agencies. The infectivity is more, but morbidity and mortality is by and large the same.
Absolutely. I hope that answers your question. And in the end, I would like to thank you, Dr. Kapil Sikka, for joining us today. And with this is a wrap on this edition of our phone-in program. And friends, we need to prepare an army of young nurses and doctors on standby to monitor the third wave. So mask up, stay safe, India, and many thanks for watching India Science. Namaste.
If you are hearing me, thanks.